I want to give a quick example of what polypharmacy is about and how quickly it can happen. And this may seem a little ridiculous, but I think when you look at your patients, you'll see how this happens. This is Jeff Cotterman. He's not actually my patient, so this is not a HIPAA violation, and this is not a true story. But this is a combination of some other patients that I've seen come to me. Jeff's a ultra marathon guy, a super athlete, and is very fit, as you can tell. So one day Jeff's out lifting weights, and he wants to show off. So he's doing squats using heavier weights than usual, and he hurts his low back showing off, and he gains about 20 pounds because he can't exercise anymore. He takes ibuprofen for the back pain to alleviate some of his discomfort. He now needs an antacid because the ibuprofen is irritating his stomach. His blood pressure goes up as a result of his weight gain, sedentary lifestyle, his pain, and taking ibuprofen. He now takes amlodipine for his hypertension. We add a stool softener for his constipation, which is caused by the amlodipine. He now needs a diuretic because he's starting to get swelling in his feet from the amlodipine, so we add hydrochlorothiazide, which is also known to raise sugars. So he starts Norco for the back pain because the ibuprofen is no longer working anymore. And then his constipation gets worse because he's on amlodipine and now a narcotic pain medication. Now he starts turning to comfort foods, and he gains 10 more pounds. He now gets sleep apnea, so we get him a CPAP machine to help him get through the night. His sugar starts to go up, and we start him on metformin, and then we add glipizide and Januvia, but his sugars keep climbing. We start insulin to control the sugars, and he gains 20 more pounds as a result because he has worsening insulin resistance. Now he's diabetic and needs statin drug, baby aspirin, ACE inhibitor, so that we can stick with the medical guidelines. So he now gains 20 more pounds as a result of our actions. Now we need to order a wheelchair for him. And then we go up on insulin to help get his sugars back down. Now we have diabetes complications several years down the road, including cardiovascular disease, amputations, dialysis, and blindness, all these things that we see in clinical practice. So because he's depressed because he can't work out anymore, we have to add a sleeping pill to get him sleeping at night. So this is his med list after a short time. You can see all these things. Now we have him up to 18 medications, and then we put him at risk of cardiovascular disease, dialysis, and all these other terrible things. So this is happening quite frequently in the United States. So this is modern medicine, and they wonder why doctors are committing suicide at record rates now, because we're frustrated and we're helpless. Because these things, processed food, sugar, anger, resentment, not sleeping, all these things that Jeff's experiencing now are all leading to his disease processes that we're trying to treat with medication: diabetes, depression, reflux, sleep apnea, obesity, etc. So is there a light at the end of the tunnel, or is it just a train coming at us?